Hello, everyone, and welcome to the launch of Investment Grade Startups. I'm Nguyen, one of your co-hosts, with Simmy Hundal, my co-host here, who's actually this was his idea. So I'm gonna ask him to share a little bit more about what the big purpose is for investment grade startups and why now.
And thank you. I am really excited to be putting this in motion. It's been a labor of love for a few months, and I couldn't have done it without you. Investment grade startups is something that I've been thinking about as I've been interacting with some really impressive founders that are working on really cool projects, one of whom I'm proud to share their story and have them present in just a minute. I was seeing that I had a couple of groups of friends that didn't necessarily cross paths,
Mm.
and one could definitely help the other. And that broke down into groups of founders that are working on startups, many times heads down, very deep into a product or project, a problem. And then other folks that had been there and done that, and maybe had moved on to investing, maybe had moved on to working for corporate, etc. And I wanted to bring those folks together. Um, Enter investment grade startups. As I met these investment grade founders and startups that I felt were investment worthy, I wanted to introduce them to the world. And when I think of investment, I think of that from a broad lens. That's not necessarily funds, it's also expertise, it's also time, it's also connections. And so the purpose is to support founders and startups that are worth investing.
That's
And
awesome. And I'm so glad that you brought that up, that investment is not only monetary, but perhaps investment as an advisor, investment in helping with, marketing efforts and other things that a startup will need. So I love the idea. And it really spoke to what I try to do is help connect people. And so it was an easy yes to say, that I would come on board and collaborate with you. And I'm really excited that we've got our first guest today. It's going to be Voythos, and it's somebody that you're familiar with. And so, without further ado, let's go ahead and bring Joe on, shall we?
that sounds great. Welcome to the program, Joe. It's so good to have you.
Hi, everyone. It's great to be here, Simmy, and thank you so much for having me. And super excited to be a part of investment grade startups.
Likewise, man. Well, the floor is yours. You can kick off the deck, and then we'll jump into Q&A afterwards.
Perfect.
And for those that may be tuning in, feel free to ask some questions in the private chat, and Ann and I will do our best to get to them as we go through the program.
Awesome. So thanks again, everyone, for joining. My name is Joe Maycoid. I'm the co-founder and COO of Voythos, and we are reinventing the way that doctors use data. Just a quick intro to start on myself and my co-founder. So Sophia up there at the top, you see, she's a vascular surgeon, over 10 years experience, being extremely frustrated with using tools that don't meet the standards of today's technology. And she's a constant pusher of the status quo, an incredible idea generator, and has an incredible vision, and has set out an incredible vision for what we want to do with Voythos. My background is primarily in digital health sales. I have experience with both large and small organizations, and I'm primarily specializing in early stage sales motion. Together, we really believe that we have a pretty dynamic team capable of tackling what is quite a challenging problem, as we'll talk more about here. So physicians are constantly burdened by manual data entry, monitoring, and interpretation. If you are familiar at all with healthcare, you've probably heard the complaints. This has caused rampant burnout, but more importantly, it's led to significant delays of care and reduced quality for care for patients. Again, you've probably, if you've touched healthcare at all, you've probably heard these complaints, but I think it's important to sort of drive it home with a personal anecdote that was sort of the genesis of Voythos. And it has to do with Sophia and her clinical practice. She's a surgeon. She operated on a patient. Surgery went very well, technically, intraoperatively. She saw the patient post-op. He looked fantastic. Everything went normal and according to plan. She went home that evening, not thinking much about the case, went to bed, Woke up the next morning, got to her office, opened her patient's chart in the electronic health record, and immediately panicked. That patient, overnight, their hemoglobin had dropped to a critical level, and it was reported in the electronic medical record system 10:30 the evening before. Unfortunately, they tried to rush that patient back to surgery, but it was unfortunately too late, and they lost that patient, which is quite a sad story. But it really got her thinking: why in the modern era, and this is in 2021, are we relying on burned out, overworked, overtired, overstressed, whatever overword you want to throw in there, healthcare workers to manually mine and interpret data and flag critical issues? But she said to herself, being an innovator and a pusher of the status quo, what if we had a system that could surveil the electronic health record? And if you're familiar with healthcare, you probably know this term, but it's essentially a medical repository of patient data that's used for clinical care. But what if we had a system that surveilled the EHR for specific patients, identified the ones who needed attention, and then prompted the physician to take action? And that's the genesis of Voythos. So Voythos is a mobile physician companion that's constantly monitoring the EHR, prompting action, and initiating care workflows. The goal is to make sure that what happened to Sophie's patient a couple of years ago never happens again. It's about reducing delays in care to save lives and limbs. We like to call ourselves, we're building Superhuman for doctors. So if you're familiar with the program or the application Superhuman, it basically sits on top of complex email repositories and surfaces information at the right time and prompts action from the user. We're trying to build the same thing for physicians. And it all comes back to that problem that I was mentioning earlier and bringing some data into it. In the US, despite how much money we spend on healthcare, 20% of GDP, our avoidable mortality rates are far higher than most other developed countries. And frankly, with the amount of money we're putting into healthcare at over $4 trillion, that's frankly unacceptable. And we need to continue to build tools and drive innovation to try to solve this problem. Just a quick view of what the platform actually looks like. So basically, I'll walk this through from left to right. So on the left, we're starting with monitoring with preset physician parameters for individual patients. Voythos will then surveil the medical records, surveil critical labs, vital signs, findings in the notes, and then identify patients that need action. Moving over to that center screen, identifying them, flagging them to the physician and notifying them, and then prompting that physician to take action with their individual order set. So this is an example. There's findings that are likely for acute appendicitis. We're going to pull up the patient's pre-generated order set, consult general surgery, start antibiotics, make this patient NPO, and that physician can then decide whether they want to go ahead and trigger those actions. Really, again, it's about reducing delays in care to save lives and limbs. Just want to quickly touch on where we've been and where we're planning to go. So in Q1 of 2022, we did develop like a prototype that we could launch for a beta test with 15 physicians. That actually led to our first enterprise contract being closed in Q2 of 2022 before we actually had built a fully workable system. We then used that to raise a little bit of angel funding to build an MVP product or a V1 product that we have just recently launched for our first client that signed that contract. Have some good news on that. We actually just completed our go live authorization with their EHR partner on Friday of last week. So we are all set to go. We're just finalizing a timeline for us to actually turn that on and have the physicians start using it. So super excited to go live with our first client. In Q3 of 2023, so by the end of the next quarter, we'd like to close 5 enterprise contracts. And by Q2 of 2024, we'd like to expand that to 25 enterprise contracts and have secured 2 hospital pilots. So talking a little bit about competition, I think it's important to bring this up. There are other companies that are certainly in the clinical decision support space, trying to flag things for physicians to optimize care workflows. After a lot of extensive customer discovery, talking to nearly 100 physicians, what we found is that other companies are basically using broad parameters that are not patient specific. What this results in is a significant level of notification fatigue. So the physicians essentially are being constantly notified for things that they don't necessarily care about. And that eventually defeats the purpose of the system in the first place. So Voythos, what we do is we allow the physician to pre-select which patients need tailored monitoring, and they can pre-select that in the user interface on specific patients. So if I'm a surgeon, I do three procedures. At the end of the day, I can pull up and say, okay, on this patient, I want monitoring on hemoglobin. On this patient, I'm concerned about the creatinine, and on this patient, I'm concerned about their potassium levels. And Voythos will then monitor those things in the background and trigger the necessary workflows when those thresholds are crossed. Getting into a little bit of the numbers from a market size perspective, we do believe the market is extremely large. $36 billion if you look at a global market for all licensed physicians and advanced practice providers. We do feel that this platform can deliver value to anyone who touches the medical record. So quite a large TAM. Obviously, we are not trying to boil the ocean to start. So if you look at that, the number on the top, 68 million, where we're focusing for our initial go-to-market of private practice proceduralist physicians in the United States. And I'll talk about in the next slide a little bit about why that is. So our go-to-market is starting with those private practice outpatient clinics and surgery centers. There's a few reasons for that. My background is in digital health sales. I know that it can be challenging to sell to large hospitals and health systems when you're just a very early stage startup. So we needed to figure out a strategy where we could get into the private practice space, outpatient clinics, shorter sales cycles, with a proceduralist physician, because they're the ones who are feeling the pain of this challenge the most, and being able to then get that in and then work up market into larger hospitals and health systems. I also think it's important to address why now. Why is the solution needed now? So health systems really needed efficient ways to manage. They're all dealing with staff shortage crises. Nurses, especially, and physicians now are leaving the industry at alarming rates because of the burnout. The pandemic accelerated this already existing trend. Because of this, there's now an unmet market need for increased patient surveillance. The workforce, the healthcare workforce, is stretched too thin, and they need tools to help them monitor patients, surveil patients, and assist them and augment them in their day-to-day jobs. There are enabling technologies and, importantly, legislation that are making EHR integration significantly easier. This is particularly around the Cures Act, and also the language, the API language moving from HL7 to FHIR standards, which is making these integrations a little bit easier. The demands on physicians' time are at an all-time high, and burnout is rampant, and patient care is suffering. It goes back to that problem that we were talking about at the opening slide. And lastly, millennial age physicians who are facile with technology are really becoming a growing part of the portion of the healthcare workforce. So the team, I touched a little bit on Sophia's background and my background. We also have a fractional CTO who's a 4-time technical co-founder, Greg Misek. He's a fantastic product strategist and technical leader. He's really doing a great job assisting us with some of that work. So we have not kicked off our pre-seed fundraise yet. We will hopefully within the next 2 to 3 months, but we're looking to raise $750,000 on a safe. That will get us to 50 commercial clients, $300,000 in annual recurring revenue, 2 health systems pilot secured, and we'll use those funds to hire a lead engineer and product hire. Thank you all so much, and I think we're gonna open it up for Q&A.
That was awesome, Joe. Thank you for presenting. From my perspective, I've seen the deck previously, and we've chatted privately, and I can tell that you've come along, especially with the implementation of that first go live. Congrats, man.
Thank you.
No, I loved what you shared about Dr. Khan's big purpose, right? Because when I've come across founders of unique and innovative solutions like yours, there's always this story. What's the big story? What's the big purpose? And she saw the solution, she faced it, or excuse me, this challenge and this problem, faced it herself, and wanted to create a solution for herself, but as well as her fellow physicians and healthcare providers. And I love that you shared that part of the story, because it helps to resonate with your end users and the stakeholders that you're seeking. I did have one quick question about your unique value
Mhm.
proposition. You had mentioned that you are focused on specific items, right? Like whereas your competition has very broad parameters and you're focused on specific parameters. Is that something that you think would give you the edge, or are there additional things that would give you the edge over your competitors?
Yeah, it's a great question. So, and that really came from extensive customer discovery, really talking to physicians who had used some of these tools, but we know that they have not been widely adopted yet, and just trying to better understand because there's clearly a problem here. They all recognize it, but it's not being solved by the current technology. And it was really trying to pick that apart and understand why, and figure out, okay, what is actually needed here. And it kept coming back to that every patient's different. Every patient needs a specific
Yeah.
sort of monitoring. In the past, this is done if you know you have a great nurse that you're comfortable working with. You just let the nurse know, hey, I need this, these things watched for in this patient. But that can't always happen. Again, going back to that challenge that the nursing workforce is under right now, that's not always the case for every situation. So that's where we really felt the need to provide a very easy to use interface to be able to manage specific patients individually, was a unique differentiator.
Yeah, that sounds great.
Thanks for digging into that, Joe. And that seems to be the unique insight that you folks are bringing, especially with Sophie's experience. Tell me more about the implementation. What are some learnings that you've had after the first go live?
We've had a lot of them. So we were warned about this by veterans in the industry, and I think we just were like, "Oh, we'll figure it out. We'll figure it out." And they were right. It was more challenging than I think we had thought, but that's the fun of it. Is you learn and you get better at it. I think understanding how many things the actual client would need to do to manage that implementation. I think that was probably the most surprising thing. So just being able to set expectations up front on that, I think maybe would have helped out a little bit. And that's something we'll take with us into the next one. That would be, that's kind of my primary takeaway. It did take us a little bit longer than we wanted to, and it wasn't so much that it was complicated work that our team needed to do. It was just things getting bottlenecked. Obviously, our clients, they're very busy trying to take care of patients. That's their primary focus. So you need to be able to make it work to fit into their workflow.
Makes sense. Busy doctors taking care of patients. They have a lot on their plates already, and trying to navigate that with a systems implementation isn't always easy. Good. You you didn't necessarily split it up in this way, but this is how I'm going to describe it. For your current version of the product, you're taking a lot of the functionality of an EHR, electronic health record, and bringing it to the mobile interface. In the future, you're thinking about providing a new version of the product that provides notifications, alerts to doctors that can be customized. Can you tell me more about that version of the product? Specifically, have you started tinkering with the prototype? Where are you with that?
Yeah, so the current product, so that's a great question. We really needed to figure out, Simmy, a way that we could build something relatively quickly. So we needed to find some low-hanging fruit. And we kept coming back to this challenge of physicians talking about the constant manual data entry and then interpretation of that data. So we figured, okay, if we could build something where they could use their voice, they could use it on their phone, they could mobily enter notes, they could mobily then voice dictate to read things from the chart, that would offer value that we could then get into the market with some initial traction. So that was the first thought. We did, that was part of that beta that we did, that beta prototype testing with multiple physicians. We did iterate it based on that feedback. Honestly, what we're looking for is to get it in an actual system, which we're ready to get that going here in a couple of weeks. And I'm just so excited to get the feedback, because I know there's going to be all these things that it's like, well, if we could do this would be really helpful. And it's like figuring out, okay, what are those threads and those pain points that we can potentially solve while we're still at the stage where we could offer that kind of service to a new client. So really, really excited to start getting that actual user data and feedback.
For sure. You can't replace live customer feedback.
Yeah,
Totally.
absolutely. And oftentimes, what we have in theory in practice comes out to be a little bit different, right? And so absolutely having that actual feedback, as you said, is going to be invaluable.
Absolutely.
As you think about long term, I see it again going back to those two phases. How do you think about let's say that there's another team that also has a doctor founder that is trying to utilize AI in order to come up with notifications, make it easier on the care team to provide notifications. How do you see yourself maneuvering compared to a similar team that is in this space? There are folks that have gone through programs like Y Combinator that are making strides at addressing physician burnout and the demands on note taking and alerts, et cetera. How do you see yourself differentiating from those teams?
Yeah, so it's another great question. Look, I think if we didn't have competition and startups trying to do this, we probably wouldn't be solving a problem that was that important. So I look at that as usually a positive sign when there's other competitors in the market. I think it's just staying relentlessly focused on our customers and solving their needs. And at the end of the day, there are a lot of disease states, there are a lot of pathologies that need solving. These are not all going to get solved overnight. Voythos is not going to solve them overnight. So there are multiple problems to solve, and actually multiple is probably not a strong enough word. There are tons of problems to solve just on this thread of delays in care in both the inpatient and outpatient space. So I think that's our biggest thing is just staying focused on the customer. We do think we have unique insights that put us at an advantage. And also I think our business model strategy of working up market, I do think that can be a unique differentiator as well from a go-to-market standpoint.
And by upmarket, you're talking about with larger enterprises, hospitals, given your experience.
Yep, you're starting in clinics and outpatient space, smaller, shorter sales cycles, easier integrations before trying to tackle the large health systems that are going to be more complicated and present different challenges.
So forgive me if you went through this when you were going through your deck, and I was just thinking, we've got an app and the physician is entering all this data and they can use their voice to text, which is phenomenal, right? How many of us use that as a very convenient way to enter data or text things out or talk things out? What happens from there? If there's notifications that need to be made to, say, a nurse who is going to check in on a specific patient, is there a portal that all this information goes into from the app then?
Yeah, so it's actually being collected in the electronic health record today. So that's actually outside of Voythos, and it does get confusing. So this data is all being collected. They're like in the inpatient setting, a patient that's on the floor or in the ICU, they're constantly getting workups, vitals, labs done, and this stuff is automatically getting reported into the EHR system. We're surveilling that data to say, okay, what are the things that we can pull out of that and surface to the physician at the right time with a recommended action.
Gotcha. Okay. Yes, I remember you'd mentioned using the EHR, and just from my own experience with my dad being in the hospital recently, yes, it was a constant, right, that they were inputting this information. And so you would pull out what you were looking for, such as target data, and then be able to notify your physician via the app that attention needs to be paid to a specific patient for a specific reason, right?
Exactly. That's exactly it. Yep.
Awesome. No, that sounds awesome.
For sure. I think there's tons of data that is coming through, tons of alert fatigue, and this is going to be a value add.
Absolutely. And then that's a great term, Simmy, right? Alert fatigue, because we have notification fatigue. And so how do we ensure then, aside from the doctor saying, this is what I want to see, how do we ensure that there is other pertinent data that make it back to them that they may not have thought about?
That's a great question, and it's an important one. I think right now we are trying to solve obviously the clinical delays in care problem, but the notification fatigue one we're trying to solve as well, because we hear that a lot. Like there's just too much notification fatigue, and then that just defeats the purpose. So we're focused on solving those two problems at this point. I do think there is a lot more that we're going to be able to do, and we are in a precipice of entering a whole new world of what artificial intelligence can do for us. I think all of us are, I know my eyes have been extremely opened by LLMs and their capability. And I think that's going to open up incredible avenues for all of us that are trying to solve these problems. I think there'll be ways to use machine learning to be able to then surface information to physicians that they didn't already think about, while still managing that notification fatigue. And basically what it's going to come down to is having extremely accurate algorithms. And how do we solve for that? I don't think today the technology's there. And that's why I think we're running into a lot of this notification fatigue challenge, these notification fatigue challenges.
Well, I've got a question that may be a nice transition, as we are already 3 minutes till the end of the program. Joe, who is your target client these days? Can you tell me about who are you looking to do business with?
Yep, absolutely. Private practice proceduralist physicians in the United States. So proceduralist means a physician that performs some type of procedure. That could be most commonly a surgeon, could be an interventional cardiologist, a gastroenterologist, a podiatrist. All those things are kind of fall into our space. The reason that that's our first go-to-market is they are operating clinically, usually in a lot of different settings, right? They're doing procedures sometimes in their office, they're doing them in a hospital, an outpatient surgery center. They feel a lot of pain with these challenges and these workflow delays, and then all the sort of burden of manual data entry that tends to just pile up to the end of their day, and they do it in what they call their pajama time, right at home from 8 p.m. to 10 p.m. And that's part of the pain point that we're looking to solve, especially with the version 1 product.
Makes sense.
Well, you mentioned improving the quality of life for the providers, the physicians as well, and that's a great point right there. You said exactly, when do they have time to do that? Not during office hours, if you will, or during their clinic hours. It's going to be after hours when they're at home, affecting their own personal lives. So, no, absolutely.
What is the best way? I'm sorry, Anne. I was going to ask Joe, what's the best way for folks to get in contact with you?
So email or LinkedIn are great ways. I'm always answering emails and LinkedIn messages when they come in. So email is joe@voythos.io. And then LinkedIn, obviously, you can just find me at Joe Maycoid. If anyone's a physician that's going to be listening to this, you can go to our website. We are looking to sign up physicians to join our Voythos Pioneer program. This is basically just join our mission to help solve this problem. That could be getting on a call for 20 minutes and just giving us feedback, or that could be, hey, we want to implement version 1 and start testing it and using it. So a lot of ways to get involved and help us out on our mission to reinvent the way that doctors use data.
So would you say that's one of the most important stakeholders that you're seeking at the moment is physicians in these types of clinics and outpatient facilities to help you really test the mettle on this application, right?
Absolutely.
Great. Well, I appreciate all of the efforts that you and Sophie and the team are making in solving this important challenge. It's going to make a difference for the doctors. It's going to make a difference for the patients, and hopefully for that huge bill that we see as a country as well. So
it's unsustainable right now. So,
100%.
No, I agree. And thank you again, Joe, for coming on and sharing with us about Voythos. This is, I think, definitely a solution that is needed by both physicians and patients, right? Because you think about being a patient yourself and thinking about, what if there's a mistake, because there's just so much information flying around and there's so many people with their hands in the data, in the information, that, how am I assured that the right decisions are made for me as a patient?
Very, very well said, Anne. That's exactly what it's ultimately about the patient, and anyone who gets into healthcare, I think is focused on trying to help patients.
Yeah, absolutely. Well, thank you everyone for tuning in. If you're catching the replay, please let us know. Again, connect with Joe on LinkedIn. Here is his URL again, Joe McCoy. Very easy to find on LinkedIn as well. And if you'd like to learn more about Voythos themselves, it's voythos.io. Tune in for next month's guest. We will announce that shortly. But again, thank you so much, Joe, for being our inaugural guest today on investment grade startups.
Big thank you, Joe.
Thrilled to be here. The thanks are to you both. So thank you for having me, and I'm excited to be a big fan of investment grade startups down the road.
I love it.
We're excited to bring more startups to the forefront. So tune in next time, everyone. Thank you.
Bye.
Thanks, everyone.